So why we have to check for this is the abdominal groin region palpation. So in case of any displacement of the intestines, so that is called as the hernias. So different type of the hernias we are going to found. So these things, so is maybe is a epigastric or umbilical hernia or inguinal hernia or femoral hernia. So different type of hernias we are going to find during this urogenital examinations. So here we have to explain. So I'm going to examine the internal canal, so which run along the groin region. So we have to palpate in the inguinal regions. So how to place it here. So where exactly we are going to place our thumbs, our finger pads, how to place on the inguinal region, how to palpate for the any external mass. So this one is going to be especially for inguinal hernia and also femoral hernia. And also I will be inserting fingers slightly into the canal. So you feel some pressure, but not pain. So we have to explain, we are going to place. So if you put the fingers, we are going to keep into the inguinal canal. So there is going to get the pressure. So it should not be painful. So slightly, we should not give more pressure. So these things are going to be examined the hernia. So that means we are going in displacement in the inguinal canal. So these things we have to explain clearly. And also while examining these hernias, we can ask them to turn head towards one side. So ask them to turn to one side, ask them to cough. So while examining this hernia and the groin regions, if you ask them to cough, so this will give the more clues about the hernias. So that means if they cough, so automatically because of the increased intra-abdominal pressure, so it leads to we can clearly see the umbilical, we can see the hernias clearly while coughing. So if they cough, it will be pronounced. So that means the hernia size and also is going to be increased. The bulge also going to be appears clearly. So that's the reasons we have to ask them to cough during the examination. And again, let me know if you feel any discomfort. So if you ask them to discomfort, so we can check for any other abnormalities. So these hernias are going to be two types of hernias in the groin regions. So others are the different type of hernias we can see in the epigastric and also umbilical. But if you come down in the groin region, we are going to check for the femoral hernia and also inguinal hernia. So this femoral, how to differentiate the femoral hernia and also inguinal hernia. So this femoral hernia are going to be below lateral to the pubic tubercle. So if you see here, these two, this is pubic tubercle. So if here, this is going to be the lateral side, and also this is going to the medial side. Inguinal hernias are going to be the medial side. So if you palpate where exactly having the bulge, so we can differentiate easily. So this we are going to identify the different type of the hernias. And also next one, we have to place the fingers into the inguinal, like a canal regions. So we should not give much like a pressure. So they are going to feel the pressure. It's not the pain. So insert the index fingers, that is the second distal creases are entire. So is a pinky fingers. So at the angle coins sighting the inguinal canal. So if you place in the inguinal canal, so we can palpate, is it the like a hernia or any masses, any enlargement or any lymphadenopathy. So we can examine clearly. So these are the examining for the hernias. And also we are going to place the fingers into the canal, so into the inguinal rings. So we are going to palpate any external mass or any like a lumps.